So why did I choose to apply for Queenan? Well, I really wanted some concerted time to be able to dedicate towards exploring perinatology on a worldwide scale. During medical school, I had spent time in Tanzania working on some medical education and human resources for health projects. During residency, I spent time in Kenya working with the residents or registrars at Moi Teaching and Referral Hospital in Eldoret, Kenya. So I felt like I had had an institution-based experience thus far, but I really wanted to see, well, how does this work on a larger scale? If you're stepping back from just one institution, working with one patient at a time, working with one resident at a time, working with one attending at a time, how do we make these policies? You know, the registrars I would talk to, they would refer to the WHO policies for partographs. And using partographs, and that's not something that in the United States that we really use, but that is something that is heavily relied on, and what the WHO says pulls a lot of weight with how healthcare is done in the U.S. and so in the world, and so I wanted to have a better understanding of that, and then get to just help with some of the work that the WHO is doing. I worked on two main projects. These aligned with things that I was interested in and with what the WHO had going on. You can imagine the WHO is a very big organization. They have a lot of different projects going on. And 6 months is a wonderful amount of time, but in the span of what the WHO does, 6 months goes by very quickly, so you have to figure out how to get yourself integrated. So two projects I'm going to tell you about. One is looking at maternal causes of death, and one is looking at maternal morbidity. So I like numbers, and I like asking why about numbers. So as you know, we spend a lot of time thinking about maternal mortality. That's one of the big indicators that the WHO has talked about and the UN has talked about. If you think about the Millennial Development Goals, if you're familiar with those, one of the Millennial Development Goals is to reduce maternal mortality. Well, if you don't know what causes maternal mortality, how do you reduce it? So you need to know the causes. So that's one of the projects. The other one is looking at maternal morbidity. Now kind of just be thinking about, well, don't we already know what maternal morbidity is, and don't we already know numbers about that? Think about that as I'm telling you a little bit more about the causes of death. We tried to maximize my calls as much as possible before I left. I continued doing my research collaborations for the research that I was doing back at University of Utah. And then I made sure that I'm catching up on my calls being back. We're really fortunate with the way that we're structured in that the fellows take call with the attendings. And so it's not that, and we have 2 of us per year, so there's 6 fellows, but the 6 of us don't cover all 30 calls. Actually, it would be basically 60 calls because we cover 2 hospitals, but those get divided up amongst the fellows and the attendings. So our call structure made it a little bit easier for me to be gone during that time.
Was yours considered the 6 months, research time or elective time, or?
Yeah, so it was considered part of my, I think we technically put it under elective research time. So our program has about half of the time as research and half of the time as clinical. So this was 6 months of my 15 months research. I think this is an absolutely fantastic experience. If you want to have more exposure to health policy, I think in particular, and to also see how publications get made with the WHO, how the WHO works with ministries of health, and how the data that they come up with then feeds back into improving care on a worldwide scale, that this is definitely the way to go. I was able to do a little bit more site-specific work with my trips to Jamaica, looking at what we called a triangulation project to ensure that we were doing the algorithms correctly. But that wasn't available for all of the projects. So I think you just have to have in mind, do you want something that's more site-specific, you're working with patients or working with people who are working with patients, or are you okay stepping back and looking at data and looking at policy? My fellowship technically ended at the beginning of September. However, I have been invited back a few times. I went back in November for 2 weeks to prepare for a steering committee meeting for the Maternal Morbidity Working Group. So I basically helped on the statistics side and getting the presentations ready and thinking a little bit more about that before the steering group got together. I continue to have phone conferences regarding both of the projects that I'm working on, and then I'm actually headed back to Geneva in a week and a half for the final meeting for the Maternal Morbidity Working Group for its current funding status. I think that's probably going to continue, the Maternal Morbidity Working Group, because it's an important thing to focus on. But we have that final meeting coming up, and then the steering committee meeting after that, so I'll be going back for that. I also have ongoing work with the cause of death analysis. We were hoping it was going to be something that I could get done while I was there, but we've changed direction a little bit in terms of the systematic review and our inclusion and exclusion criteria. So we're not going to get this published until 2018, but I've got ongoing work with them to do that. In terms of outputs, so we have the 2 posters so far. I should be this week getting our results manuscript sent to me. So while I was there, I worked on 2 or 3 manuscripts that are getting rewritten. The functioning work that we did, I mentioned that we're collaborating with a group in Brazil that has looked at functioning in postpartum women after severe maternal morbidity. And so they had actually published 1 or 2 papers on their data already, but we asked them to take a little bit more of a look at their data and look at the going from the the HUDOS 36 question to the 12 question. And so we have at least 2 manuscripts that are coming out of that collaboration, and potentially 4 that are coming out of that. The triangulation project is a little bit on the back burner right now, but we will be working towards that, and I'll probably be first author on that particular effort, and then the cause of death is going to get published as well. So I should be an author in some form or the other on at least probably 6 papers from the work that I did. And then in terms of mentorship, my interests align best with Doris. And so I spent most of my time working with Doris as my mentor. But Metin is great, and he also has a number of different people that he works with. So he's over the maternal and perinatal outcomes group, whereas Doris is in the at-risk and adolescence group, and that's where the estimates that the WHO does, that's where they are kind of housed in that particular division. So Metin and I met a few times, but none of my projects really aligned with what he was doing, but they have some fantastic things going on. Listen, I'm not sure what you've figured out you're going to be doing, but it was very much open to me to kind of choose my direction of quality of care is really cool, let's go in that direction, and that would happen under Metin and working with a few people there.